You're busy, you've got a decent practice, but nobody wants to be decent. You want to be great, and you want to have a great practice. So how did the most productive, profitable dentist in the nation balance real life, work, and profits, and somehow make it all seem fun? Well, it comes down to simple, everyday practices. So grab a lunch, join us as we chat with top clinicians and influencers to discover their formula for uncommon success. Are you ready? Then it's time to explore everyday practices with Vicki McManus-Peterson and Dr. Chad Johnson.
Today, I am so excited to have one of my very good friends, Dr. Meghna Dassani, with us. And for all of you out there, it's going to be like we just said, it's going to be like you're in our living room eavesdropping on a conversation with two great girlfriends. And I am so thrilled. Meghna, you are our second female dentist that we have interviewed. And I just love giving equal time to the women in dentistry. You're so creative and vibrant and changing the world. So thank you for being here today and welcome to Everyday Practices.
Thank you, Vicki. It's so good to connect. It's like, we're able to pick up. We haven't talked in how long? We're like, oh, hey, how you been?
How are the girls? How did they get to be teenagers? So tell our listeners where you practice and what your practice looks like. What style of dentistry do you provide?
Certainly. So I practice in Houston, Texas. I am a general dentist. I love bread and butter dentistry. I do that every day, all day long. But with health issues that my family has been through, and I know you're aware of those, Vicki, I got into a more holistic, for lack of a better word, way of looking at the patient as a whole, because we get so focused on the drill and fill aspect of dentistry, we forget that there's a person attached to that too, right? I started to look into airway. I started to look into nutrition, because all of that does affect our patients. And the more we got into sleep apnea, the more we got into oral systemic link, I realized it affects our kids too, not just the adults, because that's where we started.
Right.
And now we see a lot of kids. So pretty much we do everything. We look at patients as a whole. I do have a special focus on sleep apnea within the practice, be it for adults or for kids. And it's gratifying. It is so satisfying to be able to help these patients. Don't get me wrong. I love a buccal composite. I love
Really? I wish you could see Meghna's face. Like, she's glowing when she talks about nutrition, airway, helping the children. And then she's like, yeah, don't get me wrong. I still like to drill teeth too. Yes.
I love helping patients breathe. So you do see how much better they feel. To me, that just makes my day.
I love that. Well, let's talk. Chad's not here, so we're going to talk clinical. He gets a little too nerded out on clinical if I let him interact, but I'm not a dentist, so we won't get too nerdy here. Two things that I know you do really well, the airway. I want to talk about that a little bit more. And for those listeners who maybe either aren't doing airway diagnostics or have tried it in their office, but it was didn't really catch on. They didn't get it. I'd love to find, because I know you make things simple to understand. You take things that are very complex and you break it down into something that's fun, enjoyable, easy, sustainable, repeatable. So I want to really pick your brain on sleep apnea and airway, and also the oral systemic, if you're still using the microscope, what the reaction is with the patients. Like, you're doing some really cool stuff. So let's start with maybe airway. And we just had a great conversation about pedo airway. That I really would love to dig into a little bit more.
So a lot of times, we go to all these classes and courses and we come back fired up, right?
Yeah.
And I'm one of those. I'll be texting my team, let's order this and make sure we have this for Monday morning. And I
remember coaching you going, no, don't order all of that. We got to look at the budget.
Yeah, we're not going to talk about that. For a long time, my team would be like, oh, yeah, right. She's going to come back and nothing's going to happen, because we come back with all of this training that is amazing, that needs to be implemented within the practice. but you come back to everyday life. Life just takes over. And that's what happened with us, actually. When we started with sleep at the practice, we've been doing sleep for maybe about 6 years now. I think I was just stubborn. I think that's what it is. I'm stubborn enough to not want to give up when I feel so passionately about something. So we stuck with it at the practice. We created systems, we reorganized those systems, until we came up with something that was predictable. We knew exactly what needed to happen, what I needed from the patient, what I needed from the team, what forms needed to be filled, what was a workflow to where we're actually able to help our patients, but we're actually getting paid. Because we all know, what is the big monster that we're scared of, right? Medical billing. Oh my gosh. You just talk about that and we're like, oh, you know what? I'm good here. Never mind. So just being able to combine that with something where you're changing lives. And like I said, I have, it's been very personal for me. I think, we lost my father-in-law to sleep apnea. And if I can find a way to have that never affect my family again, I'm doing everything I can. And realizing that there's other families out there, that there's other patients that our doctors, other dentists are able to help. It was a no-brainer. It really was. I mean, why would I not share that with other doctors? That's how many other lives that we're able to impact.
You said a really key word there. You come back all excited from CE and you learn the clinical parts. And maybe you even get a few clues about the practice management side and the billing side, but then putting it all together. And the word that you had that I love was workflow. Right. And that's an everyday practice that everybody can work on. Like, what's our workflow? And you also had the word expectation, making it really clear. This is my expectation for each member of my team. This is what my expectations are from the patients. And you didn't say this, but I think you also share with your patients, here's what you can expect from me. Right. I know you make promises to your patients, right? Like, I promise you, this is what we're going to do to the best of our ability. And they are so loyal in that because they give the promises right back.
Well, I tell every patient, yes, I promise I'm going to help you to the best of my ability. But at the end of the day, it's what happens with your body. But I also need that reciprocated from the patient. Right. Because I can talk about flossing. I can promise you're never going to get a cavity. But if you don't go home and
do it,
there's no way it's going to work. So it has to work both ways. But yes, like you said, having a workflow, having the ways to implement it. Because let's be honest here, our team really wants to know what we expect of them. They want very precise, very
checklist.
Yes. What do I do next? If this, then what? And for us to be able to give it to them, I think that's huge. And that's what has helped with our sleep apnea program too. Just being able to share it with other dentists, other teams. I tell everybody, there's no need to reinvent the wheel. Been there, done that.
My wheel. Let's bring that up. You're not only a fantastic dentist who's focused on airway and saving lives, but you're actually teaching in the sleep apnea community now. So what is your course like? What do you teach? How do we get connected with you as an instructor? You're a passionate instructor as well as a passionate dentist.
So yes, I do teach implementation of sleep apnea. Like I said, I can teach you the didactics all day long, but if I don't teach you how to go back Monday morning,
right,
or to do it, I've failed.
So I get to know your workflow?
You do, yes.
I have those checklists and the implementation and the expectations.
Yes, and how to do what. I joke, my checklists have checklists. So yes, you get everything from So yes, we do teach implementation for sleep apnea within the practice. How are we screening patients? What conversations are we having? How do we connect with the NDs? Sleep studies, what do we look at? What appliances can we give our patients? How do we build this? How do we get paid? And what follow-ups? Because it's one thing to make an appliance, but it's another thing to be able to hand it to the patient and say, now I need to see you at this time frame to see if it's working for you, to see how you're feeling. And if not, what am I going to do to be able to make sure you do feel better? Because it's not like I'm going to hand it to you and have you on your way. So we talk about all of that. And I know we were chatting earlier, just a couple of days ago, we actually launched our course on pediatric sleep apnea. And that just blows me away because imagine if you're helping kids develop airways or breathe better, not only are we preventing possibly these kids from having sleep apnea as adults, and preventing health conditions in these children. Every kid that comes in that has either been recommended medication for ADD, ADHD, I tell parents, get their airway checked because sometimes they may not need it. And that's huge. Kids that are bedwetting. I had a 12-year-old today that still wets the bed. Can you imagine? No sleepovers, no camp. We forget the quality of life that these kids are missing out on just because they're not breathing. So, we're truly changing lives. I
love that. So are you doing at-home studies with children? How are you measuring their airway with CT scans? What are you doing?
Right. So there's a combination. It just depends on what the kids come in with. Mouth breathing is never okay in kids. I tell moms that we want to train them to, breathe through their nose. We look at their tonsils. There's so many things that go into evaluating the kids. Because you have to remember, these kids are still growing. Everything is still in a state of flux. It's dynamic. So luckily, we can use these growth spurts, these stages of growth where we can kind of guide them into it.
Yes.
There's a lot of factors that go into it. Unfortunately, there's no one answer or one size that fits all. Some kids are able to just help with establishing nasal breathing. And then some do need more. Do they need expansion? I don't know. So there's a lot. You have to work with MDs. We work with a lot of pediatricians, pediatric ENTs, pediatric neurologists to be able to help these patients.
I love that. So how often are your courses given and where do we come?
All of the information is on our website. It is sleepbreathedream.com. I am very active on Facebook.
Yes, you are. I'm going to talk about that next. So we'll make sure in the show notes we have links. So if you're listening to this, go back to the landing page, go to the show notes, and look up this episode with Dr. Dassani so that you can find out more about her classes. I want to talk about a subject that is absolutely taboo in dentistry. Like nobody wants to talk about this, and we should. Nutrition. In Neighborhood Smiles and my dentist they're also fantastic. And I go, okay, let's talk about nutrition. They're like, let's not. And I go, okay, could we at least agree that sugar is bad on some level? And they're like, yeah, sugar causes cavities. I said, great. Could we agree that we stop putting cupcakes in the staff lounge? And they're like, no. I'm not going to tell the team that they ought to clean up their diet. And I go, really? Well, if we can't talk to our teams about cleaning up our diet, if we can't role model our diet, how's our team ever going to talk to our patients? And here's what they said. They go, well, our patients pay for advice, but our team doesn't. And I go, well, if we're not comfortable in our own nutrition, we are never going to get comfortable talking to patients about nutrition. But you can't talk about sleep apnea without talking about nutrition. You can't talk about obesity and the bite force and functional dentistry. If you're a big guy, to me, it all plays together, but it's having the courage and finding the time. So how do you work nutrition into your practice? Because, man, it's like threading a needle. You're the one in a gazillion that do this. How do you do it?
You know what? I'm honest with my patients. I tell them by the time I'm done with you, I'm going to be your least favorite person.
But you're so sweet when you say it.
Yes, we laugh about it, but I tell them, but I'm also going to be your most favorite person because you're going to feel so much better. And I honestly believe today our patients are so much more educated, aware. There's so much information out there, things online, patients read up. And as long as they understand that we are coming from a place of, oh, I don't want to eat your cupcakes. By the way, for everybody that's listening, she brought up cupcakes because those are my weakness.
I know, but you have these vegan cupcakes and it's fine.
We got to, but we're not going to go there.
It's a tough conversation with your patients. How does your team bring it up? Give us an everyday practice. Like, how do we break the ice on that conversation?
So I'll be honest with you. When we started to talk about it, my team did not want to be the bad guys. They'd be like, well, who's going to come in and talk about it? I'm like, sure, I'm the one that gives you a shot. I'm the one that gets to fuss at you, so I will do it. And I think, honestly, for anything that we want our teams to do, I'm a big believer in the leaders have to do it first. That's why we're leaders. We have to show them how it's done. And they hear it enough times from us, they're able to do it. So it's exactly what I say. I tell my patients.
Oh, I love that. I'm a retired dental hygienist. Nobody in their right mind would let me get close to them with a Cavitron or, a scaler. However, in the Dominican, I do get to play dental hygienist a little bit, and I do triage. And we had this one beautiful girl there with her parents. And when you go to places like the Dominican, you realize that nutrition is it's at the center of everything, right? So malnutrition in pregnancy leads to blindness, and you're just really trying to get calories in your babies. So these moms are trying to do the best they can. And a lot of times that is like sugar water or cheap and expensive candy and things like that, because the kids are just craving calories. And it is so rampant there. You're swimming upstream. And that by the time someone's about 14 and their permanent teeth are all in, that is the pivotal year. You either save those teeth or you don't, because next year they will start extracting. So, and I know you've done some mission trips too, and you see it. And this one particular girl, she needed 4 or 5 molars, and they needed like MOs, DOs. They weren't that big. We could save these teeth, but we really were restricted to one tooth. That's what we were there for, because there's so many people. And I just had a conversation with Dr. Dave Deal. I know you know Dave. And I said, hey, if I can find the time for you to do this, would you do this special for me for this one girl? And he goes, absolutely. So I had a conversation with the parents and with her. And of course, I don't speak Spanish. And so there's a language barrier. There's also a cultural barrier because sugar is not seen as bad. So there's an educational barrier. And I thought, how can I help her understand that the sugar is just killing her teeth? So I came up with this metaphor. I said, not all girls, not all children, but your child is allergic to sugar. And her teeth are allergic to sugar, and they sneeze, achoo, achoo. And when they get the sugar bugs on it, then they get these black holes. So she's allergic and she can never have sugar again. So they went home and they thought about it, and she came back and she wrote out a letter about how she would commit to eating more fruits and vegetables and less sugary things, because it's just so epidemic in our society, in all ages. And you try to do the good thing by getting yogurt, which is a joke. How many grams of sugar in yogurt?
Yes. We don't realize how much added sugar there is in so many of the other so-called healthy alternatives that we try to feed ourselves or our kids. But I think with my patients, I've realized that actually just being upfront and honest, nobody wants to feel like we're scolding them. That's when you see the wall come up, they stop listening. And I'm honest and upfront with my patients, like, hey, I love chocolate, I love cupcakes, but I know that we need to nourish our body a lot better. And the only way healing is going to happen is when we're able to give our body what it needs. And sugar does not.
Those building blocks.
Exactly. Having that very non-confrontational, I am not going to accuse you of doing it, but let's sit down and talk. And I treat my kid patients the same way. It's like, you're a smart kid, so let's talk about this, as opposed to trying to make them feel bad.
Right.
That helps a great deal. And slowly my team has picked that up too. So it's, literally everybody talks about this within the practice. We try to guide our patients, and that's all we can truly do, right? Just guide our patients.
I'm glad you said that word, because I'm sitting here saying, you are not a doctor, you are not a dentist, you are not a coach, you are not an advocate. It feels like you are a guide with your patients, like you're part of their health guide on this health journey. I'm going to be one of your guides, so I can help you understand things like airway and getting oxygen, how that affects your body. I can help guide you in what your body needs to be nourished. And again, you're just so gentle and kind and compassionate in your delivery of these messages. I love that.
Well, thank you. And I do tell my patients that. I tell them, this is your journey. All I can do is help you along. All I can do is point you in the right direction. The steps are yours to take.
Well, shifting just a little bit, we'll talk about bugs on our teeth. Tell me about your Perio oral systemic program.
Oh, goodness, my microscope. I love it. So I know you are aware that is, sleep apnea is one piece of the oral systemic link. It's part of that.
That's right.
And a lot of folks think that when I talk oral systemic, it's just perio. It's not.
Right.
It's perio, it's decay, it's airway. There's so much that goes into it, but perio is a big part of it. And, reducing that inflammatory load in our patients' bodies, we're actually helping our patients deal with that. And it's been maybe a couple of years that we created, the phase contrast microscope. And it's amazing. It's part of our new patient experience. Every patient gets the plaque sample that they get to watch. This is not even me doing it, right? It's my team that's, while they're gathering, x-rays and photos, we do that. And while the patient's waiting for me to go in, they're watching that. I mean, when you have those bugs on a big screen that are swimming around, dancing around like crazy, my job's done, because then the patient goes like, fix it. What are you going to do?
What are you going to do? In our practice, when we put the microscope in, week 1, they took a perio maintenance patient in, and he's having a breakdown, but he doesn't want him to use the laser. No more of this, no more of that. Just clean my teeth. I'm done. So they put the slides up on the monitor, and he goes, "Are you telling me I have periodontal disease?" She goes, "Yeah, we've been trying to tell you that for 5 years, every 3 months." And he goes, "Oh, well, what do I need to do?" And they're like, "Well, we want to do the laser. We want to get you on these rinses at home. We want to do these things." And it became so compliant. But 5 years of fighting with this patient, he saw one video of the bugs swimming around. He's like, "That's disgusting."
It is pretty disgusting. But I'm glad that it helps our patients understand. And it's not just, "Oh, you're telling me because."
Do you find that you're doing a lot of oral DNA testing or going to that level with it? Or what impacts your treatment recommendations on that level?
Again, it depends on so much, what kind of bacteria we're seeing. Do I see spirochetes? Do I see amoeba? How much white blood cells do we have? I do a ton of the saliva testing as well.
Right.
I am Bale-Donine trained, as you know. So I do follow Dr. Bale's recommendations. I find that it works wonderfully well. The goal is to reduce the inflammatory load in the patient's body. So again, there is no one size fits all. And I tell every patient this. I tell my team this too. There is no one size fits all, which is good and bad, because it means that we have to custom tailor this for the patient. I have to take into account what's going on with their health. I can't tell you how many cardiologists refer us patients.
Wow.
Just because I know I have a protocol that's going to help lower those C-reactive protein levels. I know that is, again, this ties into Bale-Donine, right? When they see, it's like, maybe it's time for the laser. The patient comes back. My cardiologist said, maybe it's time for the laser. I'm like, yes, I love that, doctor, because...
How did you educate the cardiologist?
A lot of times there is pushback, I'll be honest with you, because to date, we're just dentists, right?
You're not a real doctor.
I find that I did go speak, we do try to take them a lot of our information, but sending patients back with the results. We have patients. It started with this one patient who I've been trying to get in touch with the cardiologist for the longest time. Patient came in, his numbers weren't where they wanted to, things were breaking down again. And I just happened to ask him, I said, "Hey, you see this doctor, don't you? What do you see reactive protein levels like?" And he said, "That's funny you mention it, because we've been struggling to get it under control." So it was quite a bit of education, with the patient. And he finally saw the value of what we were talking about, agreed to follow with treatment recommendations. And when we saw him 3 months later, I said, so, did your cardiologist have anything to say about once, we finished all of the treatment that we needed to? He's like, he is so happy because my numbers he's never been able to get them down before. Cardiologist called and said, what are you doing? And how can I send you patients? Yes.
So it's really showing the proof of your work through the patients.
Yes. We see the same with sleep apnea too, because, when we have patients that we do oral appliances on, I tell the patients, go back to your sleep MD. Now we have a network. You do enough of it. Your referring doctors see that you are actually helping the patients.
Do you think it takes a year or two to really establish those relationships or more?
For sure. It takes time. It depends on the doctors too. Depends on what kind of relationships you have with them. If you've known them beforehand, there's so much that goes into it, but for sure it takes a while. But I just send the patients back. I tell them, go see them. And that's the proof, your sleep study with my appliance. And I tell the patient, that's my appliance.
This is the Dassani appliance.
Not really, but I take ownership.
I think you could brand it right in there, right? You could get like a little brand and right on the side. I think you could.
And when your MDs see that it is helping, their oxygen levels are better, their sleep apnea, AHI numbers are better. There's just no argument.
Oh,
yeah, it helps. It helps.
Well, I love it. And I have loved spending so much time with you. We're doing podcasts throughout our PDA tribe and our Grand Slammers and our highly productive dentists. And I think what our listeners are seeing the pattern of is that you're so productive because you're so compassionate and you're willing to be comprehensive and not limit yourself to one tooth dentistry. We really advocate giving yourself plenty of time with each patient. Just your goal is to make your goal and to take great care of people. And
yes, keep up with what's up. How can we help our patients better? Just keep getting better. And when we get better, we help our patients get better, right?
I love it. Well, Meghna, it's been a pleasure catching up with you. I think I'm doing this podcast just so I can chat with all my friends. This is great.
Chatting with you today. Thank you so much.
You're welcome. Chad and I always ask our guests one question, and you just spontaneously have to choose one or the other. Bacon or eggs?
Eggs.
Very good. Well, there you have it, folks. Another episode of Everyday Practices with Dr. Meghna Dassani, and we will get you information. We highly recommend her courses on sleep apnea. It's the how to put it in the workflow and get it implemented. So again, thank you very much.
Bring your lunch or take us to the gym again next week to improve your everyday practices. Also, subscribe on iTunes, follow us on social media, and sign up for our email list. Now get out there and win with Everyday Practices.